Hello and welcome. You're watching Wellbeing, the season 2 of Wellbeing here on AD4 TV Radio. My name is Antonietta Kalunta. I do not suffer from autism, but I do suffer from the way you treat me. These are the words of Tyler Durden, a character whose representation has become key in addressing the significant social challenges that people with autism suffer. Joining me on this episode of Autism is Dr. Badiwa Williams, a specialist and therapist who has a core specialization with pupils with disabilities. She's also the founder of the Royal School of Educational Therapy. Thank you so much for coming on the show, ma'am.
My pleasure.
Thank you. So when we want to talk about autism, moving from diagnosis to management, I think the very first thing is defining what autism is. Would you like to explain to us what autism is?
There are many definitions of autism, and every time the DSM, which is the guide for diagnosis, comes out, it's a bit different. The DSM-5 says we should look at two primary areas for diagnosing anyone who may have autism: communication skills and also repetitive activities, actions, restricted repetitive actions. Those are the two things we look at. Somebody who has autism in communications-wise may not be able to communicate like their peers, may not even communicate at the appropriate time. And then with the repetitive action, they get fixated on certain objects or certain activities. And that's letting you know that that's not typical. So when you start noticing things that are not typical at certain age levels, then you start suspecting that the child may have autism.
Okay, now one key or two key words always used when it comes to autism are, inhibition when it comes to social interaction and communication. Now, how does a caregiver or a parent or someone handling a child or handling children know the differentiate between autism and when a child is just basically introverted or has social interaction issues?
Okay, we are all different, and we all have our own uniqueness when it comes to interacting. Some people are introverted, some people are shy. That's why we say the child should not just be generalized or overgeneralized as others. We need to have proper diagnosis. However, talking about that, some children have a lack of inhibitory control. They cannot control their inhibitions. So when you see that it doesn't matter the environment or who they're with, it's still the same inhibitory control disorder that they're exhibiting. They don't have the self-regulatory skills. Then you know that it persists. If it's somebody who is introverted, may actually open up to a parent, but a child with autism will not. So that's why I say it must repeat at different settings, at school, with the parents, at church, the same rudimentary activities or the same lack of control will really appear and manifest no matter the surrounding and no matter with whom. So that's how you know it's a neurodevelopmental issue.
Okay, ma. So we don't just label children that have social interaction issues. We definitely need a diagnosis. And from what we've learned, there is no blood test for autism. How then is it diagnosed?
It must be done by a trained specialist. It's either done by a trained medical practitioner, a developmental specialist, a pediatric specialist, a neurologist, or clinical psychologist. Those are the people who are usually certified to diagnose neurodevelopmental disorders such as autism. It's not a school teacher. Okay, so we have to be really, really careful about that. There's some therapists out there who are diagnosing. It's not their job. If they have not been certified and approved to diagnose it, it's not their job. So it must be done by a trained and certified individual who specializes in neurodevelopmental disorders. So they will know if it's autism, if it's ADHD, if it's autistic-like symptoms, or if it's other, or something that is not otherwise specialized. They are the ones who can diagnose.
Talking about moving from diagnosis to management now, what is the best age for autism to be diagnosed so the child can be properly managed to fulfill everything he needs to do in life?
Most of the time, the symptoms will start manifesting when a child is about 2 or 3 years old. However, with science, current science findings, they do have evidence that they can diagnose them as early as 6 months. So what I tell parents to do is just start observing your child. If your child at a certain age is not doing what is typical, example, you're cooing to your child, instead of the child smiling or, giggling or responding to it, the child doesn't. That's not usual. If you are calling your child's name and the child doesn't act as if he or she even heard you, then you know that's not usual. So those are the little things you start watching out for. When they cannot keep eye contact, they cannot look you in the eye, you are feeding them, they're not really responsive. They have preference for some food items, actually. You'll see that some they will take, some they will not accept from you no matter what. So you start noticing that there could be something that you just don't know what. So you have to seek help.
Help.
Yes.
Yes, Ma. Thank you so much, Ma. Is autism more common amongst a particular gender?
Yes. Even though I don't want us just now identifying, as you said, labeling all males we see, you understand? But generally, yes, amongst the male population, most neurodevelopmental disorders are. You find more of them among the male population. Now, another thing we need to also put into perspective is like males and females develop differently, and they reach developmental milestones at different ages. So it's also speculated that most of the time it's not so evident in females as it is in males, just because of the biological differences. But on research, scientifically evidence-based, it has shown that predominantly males.
Now, given your study or your specialization over the years, how would you assess the current level of awareness of Nigerians about autism?
The awareness amongst those who are educated and literate, because we have some who are educated illiterates. Those who are educated and literate, yes, they are aware, because Autism Awareness Day, Autism Awareness Month, we have so many private organizations, CSOs, private schools, private centers, scientifically evidence with activities, and the media has been very cooperative in making sure that they cover this event. So amongst them, the awareness is there, and they are internet savvy, that they can go online and research. But those who are in the grassroots, those who may be really highly affected are not so much aware. They still see a child who may have autism, not knowing that it's autism and that it's neurodevelopmental, and not the child's fault. May start labeling the child as being, a witch, afflicted with a demon. They have all the spiritual, misconceptions about what it could be. They start blaming the child too sometimes, and seeing the child as an object of ridicule, and they're embarrassed and ashamed. They need to be brought up to par to let them know that this is a scientific explanation for what the disorder is. It has nothing to do with spiritual. So we need to do more on that level.
Okay, Ma. Are there any known cures for autism?
There is no cure for any neurodevelopmental disorder, but there are interventions that would help the child have functional life skills. As long as a child is functional, a child can be independent. That's what we need to aim for. Okay? Neurodevelopmental has to do with the brain, the way the brain is formed. In a typical person, when you get information, the information process, it goes to your brain. Through your bloodstreams, it passes. And from the brain, the synapse, different aspects of the brain receives messages and then translates those messages into activities or actions. And once it's done, they disseminate and send messages to other parts of the body as to what to do. When those parts of the brain are not well developed, maybe from the inception where it gets messages, it's not well developed, or where it reaches, the message doesn't sink in, the processing is not processed, then of course there's nothing you can do. But we also know that the brain is not stagnant. There's so many activities we can do to retrain the brain, to stimulate the brain, to rejuvenate itself and start functioning better. So that's where intervention takes course. So there's hope for them to get better, whatever it is, their levels. If it's communications, they'll get better. We also need to look at, what we're feeding them, their guts. The messages the brain receives is from whatever we ingest or what we feel through our senses. So we need to feed and ingest digestible, natural, unprocessed, no chemical kind of information. So when we start doing that, we start healing the brain. So healing starts from there, from what we put into our stomach. Then with the intervention that is added as external, then you have the whole body approach into helping the child get better. Not curing, but helping them get better.
Get better. We're still speaking with Dr. Badewa Williams. We'll take a break now, and when we return, we'll learn more on how to help people with autism get better. Stay with us. You're welcome back. You're watching Wellbeing, and on this episode we are discussing autism, moving from diagnosis to management. With me on the program today is Dr. Badewa Williams, who is a specialist and therapist with core specialization with pupils with disabilities. Thank you so much, Ma, for staying with us. Now, before we went on break, we were discussing about autism and helping people with autism get better things out of life. And since there is no cure, we learned from Dr. Badewa that there are no known cures for it, but all people with autism can get better. If they have problems with communication, they can get better at it. Now, Ma, I do not think we can get better at something or help people get better at something when we don't understand their strengths. Now, we hear a lot about the disabilities of people with autism, or the problems they have, or the things they cannot do. Can you help us elucidate on their strengths?
Okay. Just like everybody else, they're just as normal. We all have strengths and we all have weaknesses. We're not perfect, and neither are they. But we need to stop being fixated on what they cannot do and really identify what they can do. And that's the whole purpose of what intervention is. And that's actually the whole goal of educational therapy. You identify the strength and then you develop that strength. There's so many things that children with autism are able to do that you and I cannot do. You know, we have some of them working in science, in artificial intelligence, technology. We have some of them who are maestros when it comes to music. I don't even know how to play the piano, and I took piano lessons for a year. Today, I cannot play the piano. But we have children with autism who are making a living playing the piano, who are musically gifted. We have some with amazing memory. No matter what they see, they remember. You know, they've got skills that we don't have. We have some who are navigators, who are actually working with the Marine to help with the navigation system. I can't do that, can you?
No.
So all of them have their own strengths, especially when it's a skill that requires repetitive actions. They tend to be better at it than most people because that's one of their core characteristics. You know, they like things that are repetitive and they're very good at it. They get fixated on those things. So like things on the assembly line, they can package neatly. You know, some of them are the neatest you can find. They are organized, you know, in terms of putting things where they're supposed to be. They'll put it for you. Me, you come to my room, it's a mess. But you see my daughter, perfect.
Wow, wow, wow. This is a new side to it. This is something we hardly hear. Most times we just hear about the things people with autism cannot do. But in helping them to get better, how do you identify what they really can do and help them grow in it? Because from what we've heard, you know, they're being repetitive and going back and forth with their words. How do you get them to know that this is what you can do? How do you do that?
Number one, observation. Number two, exposure. If you don't expose them to as many things as possible, you won't know. If somebody who's musically gifted, you have not exposed that child to a piano, how would you know that child can play the piano? So the first thing is definitely you observe your child, see what your child gravitates more towards. If your child likes drawing, if your child likes cartoon figures, if your child likes the computer, you make things accessible to that child for the child to start. And you start watching and then you intervene. You train, you teach on how to do it better. For example, I have a child who, when I was teaching, I had a child who was always picking up things because it was so physical. He would grab people and just throw them. Not because he wanted to be mean, he wanted to play. He just didn't know the appropriate way to play. So his own way was to grab the person and play rough, like wrestling, because that's what he was watching. This child will eventually identify that he would work better with the fire department as a firefighter. So he became one of those people who became a rescuer. Whenever there was a fire in a building, he would be part of the team that would go in to rescue people and carry people and throw them right away, onto the trampoline or whatever is there to absorb the shock and go back. He loved it and he did it very well. So it's the observation and the exposure. Make sure you expose them to as many things as possible. Don't restrict them.
Don't restrict them. Now, beyond exposure, what do you hope to achieve with every child that has autism, or with every person with autism that you work with?
What I hope to achieve is their social-emotional well-being. That's number one. A lot of children with disorders do have feelings. They're not able to express it. Some of them have anxiety. Some of them even go through depression. Some of them are so afraid, because they're so used to being scolded, being, abused. Let me put it that way. I want them to feel better about themselves. I want them to feel proud to be who they are. So the number one thing I want to achieve is for them to have a well-rounded social emotional well-being spirit, to have high self-esteem about themselves, to feel confident and feel safe to make mistakes. We all make mistakes. It's not every time you make a mistake that somebody starts beating up on you, right? We need them to feel comfortable and feel loved. That's number one. The next thing I want them to achieve is the functional life skills. I want them to be able to survive, because parents will not always be there. So I want them to be able to take care of their own needs, primarily. Once they can bathe themselves, feed themselves, take care of their own hygiene, iron their own clothes, wash their own clothes, start cooking their own meals, clean their own rooms, and then life skills. Now, after we achieve all this, I want them to be able to earn a living. I want them to have some kind of vocational skills. So we try to train them in as many vocations as possible. So we'll find by observation what they gravitate more towards and what they start learning, and we just keep at it and keep training. So those are the things I want for them: independent life, independent and happy life.
We're so proud of what you do and the work you do. Thank you so much, Ma, for coming on the show. Now, for your final words, we'd like to know what you want to say to caregivers, parents, families, even friends, because we've heard of students in school bullying their mates who have autistic tendencies or autistic-like symptoms, or even persons with autism in school. What would you like to say to anyone who has to interact with someone who has autism?
Number one, either you're a parent, you're a sibling, you're a caregiver, you're a friend, or even a stranger. We're all different, and we all have uniqueness about us. We need to validate that and appreciate that. We need to know that God has not created any child to be imperfect. There are circumstances beyond their control that could really be influenced by environmental factors that are affecting the way their brains developed and the ways their bodies develop. It's not their fault. So let's get real. Let's be realistic about that. It's not their fault. Once we know it's not their fault, then we now have to think about how best do we treat them. How can we be a better mother, a better father, a better sister or brother, or a better friend? We need to start having this empathy for them. Don't sympathize, don't pity them, because they're not out of this world. They're just regular people. Don't pity, but have empathy. Know that, there are things that you should really need to help them to be able to achieve. Be kind, be helpful, be tolerant, be patient. And you'll be amazed. They're some of the most compassionate people you'll ever know. They give unconditional love, and they're very loyal. Their blue is blue, their red is red. They will not lie to you. They will not abuse you. They will not gossip about you. They will not harm you intentionally. So let's just be enduring, and be better at handling them. So don't give up on them. They've got strengths, just need to find them. Thanks.
Thank you so much, Mark. Don't give up on them. They've got strengths that you need to find. We've been speaking with Dr. Badewa Williams, who is a specialist and therapist with a core specialization in pupils with disabilities. Autism is a condition that lasts a lifetime. So all we need to do is rethink the attitudes we put up that puts people with autism at a place of disadvantage. My name is Antonietta Kalunta. See you next time.